Okay, so this is Ms. Roberts. I am covering Chapter 12 in the Davis Advantage book. This is talking about the woman experiencing complications during the postpartum period, postpartum period. We're starting on page 406. So one of the biggest things that we look at in this section is postpartum hemorrhage. Okay, it's the main cause of mortality and morbidity in the world as far as postpartum women. Okay, very, very important for you to know. Just like we talked about earlier, postpartum hemorrhage. We know it's okay to lose 500 milliliters of blood in a vaginal birth and 1,000 in cesarean births, but anything over these numbers is considered postpartum hemorrhage. Okay, the terminology is listed here. Focus on safety. So, wink and lollipop, you need to know that to recognize this, anything that is considered a first sign kind of gives you an indication that something might be going wrong. That's a heartbeat of greater than 110, a 15% drop in blood pressure. This is often a late sign, or O2 sat less than 95%. Okay, so you see a 15% drop in blood pressure, you know something's wrong. Okay, she may get nauseated, pale, start vomiting. You need to be massaging that fundus. You need to be assessing her bleeding. Okay. Risk factors are listed, page 407 in this box 12.1. And look at those. Uterine atony. This is wink and lollipop as well. Know this term. Okay. This is the leading cause of early PPH. So we know the late's the blood pressure drop. The early is uterine atony. Okay, this is where the uterus just kind of doesn't cooperate. It's soft, boggy, full of clots. So we go in and start digging out the clots in her uterine walls, trying to get all of those clots off of the wall where the blood starts stopping, slows down. Okay. But know this paragraph. Okay, I want you to also know this box 2.1, another wink and lollipop. A big thing is large infants, macrosomia, LGA, large for gestational age. Okay, so uterine ovary distension is another reason that we have this uterine atony, which in turn causes the postpartum hemorrhage. Right. Read through the risk factors here, and let's talk about some thrombin. Okay, this is a problem with maternal coagulation. We have something that's called HELP, hemolysis. This is the sloughing of the red blood cells, right? The destruction of the red blood cells, elevated liver enzymes, and low platelet count, and it can in turn turn into DIC, disseminated intravascular coagulation. Sepsis, abruptio placenta, where the placenta detaches. So these are major problems. Okay, we have what's called the von Willebrand disease. This is where there is a disorder in the clotting factor. Okay. So the platelet adhesion, something goes wrong. It's very rare, but it can happen. We can give the anti-hemophiliac factor complex, TXAs, every hour while in labor and in postpartum. Okay, make sure you understand that. We can also use a drug that's on page 409. And it's called Methergin. Okay, this is a wink and lollipop. This should be on your drug templates as well. Okay, for indications, so preventing and the treatment of postpartum or post-abortion hemorrhage caused by uterine acne. It is contraindicated for anyone that has hypertension or is eclamptic because it is a vasoconstrictor. Okay, so I want you to write this down here in this area caused by uterine acne. I want you to write will have a firm fundus to palpation if it works. So once you give the Metrogen, the indications is we want to stop the uterine acne or the subinvolution. Okay, so you need to write will have a firm fundus to palpation if it works. So once you give it, you wait a few minutes, palpate that fundus, and it should be firm. Okay. Another side effect's headaches. Okay, just because it is a vasoconstrictor. You're going to monitor the blood pressure, of course. Another winking lollipop. Monitor that blood pressure because of it being a vasoconstrictor. It can increase the blood pressure too much. Okay. All right. Frontal massage. So this is just some rationale procedure chart on page 410 and 411. I want you to read through on how to massage that fundus. Okay. And there's some other drugs that we can give. Metrogen is listed here, but we can also use oxytocin. This is why we bolus the oxytocin, the pitocin, whenever we're trying to deliver the placenta. We want it the vessels to constrict, to allow that placenta to detach from the uterine wall and be delivered. There's another drug called Hemabate. It's very, very expensive, and it causes some massive diarrhea. Your mama's going to have bowel movements everywhere with this drug, so just beware. Okay. Metrogen is a good one. We don't add it to the IV, we give it IM. Okay. I usually give it in the leg, vastus lateralis, because if she's got an epidural, she can't even feel it. So it's a win-win. Cytotec's another one that we can give. It's absorbed rectally and is slower than IV, but we like to give it rectally. Cannot give it with prostaglandins. Alright. We're hypersensitive to prostaglandin. It is a prostaglandin analog. Okay. It stimulates the contractions, of course. So just read through this. All of this is on page 411. These are some videos. There's a system that we use called the JADA, and I'll show you what it is. We use it, I know, at Cockwood and at Archbald. Really cool mechanism. I wish I would have invented it. I would not be teaching. But it's a very, very cool thing to help with the postpartum hemorrhage. And then there's a video that we're going to look at on QBL, quantitative blood loss. Okay. All right. So let's talk about some hematomas. Okay. So this is on page 412, 413. This is why you're doing a perineal assessment. There is a common factor in hematomas. Okay, this is caused by the pressure, the trauma that has gone on in this area. If she describes, your patient describes feeling full or swollen down there, you need to be looking. This is a vulvar hematoma. Okay. And it's painful. We put ice on there, but if they're too large, it can cause some tachycardia and hypotension. A winking lollipop in this right here. Okay, so you need to know this. Describing it feeling full, you can see the tachycardia and the hypotension. She can even go into shock. It can actually block the lochia, block the bleeding and inability to void because of the edema that's happened and pressed onto the vaginal opening and into the urethra. Okay? Just make sure you understand that. And then collaborative management, we mentioned in this section about the sitz bath again. Okay? So sitz baths are prescribed, and it just helps with comfort. Okay? Alright, and then there's a case study. Of course, I always want you to do the case studies to make sure you can put things together as you're learning those. Okay? Thrombophlebitis and thrombosis. Of course, DVTs can cause pulmonary embolisms, all kind of things. So make sure that they are ambulating early. Very, very important. Okay? Wink and lollipop. Early ambulation postpartum has declined the incidence of DVTs. Okay, very important for you to know. Early postpartum ambulation, wink and lollipop. There's some labs here. Of course, there's DVT right there. Diagnostics, some labs though. D-dimers, PT, PTTs, MPs, Chem panels. So make sure you understand that those are the lab work results that you'll be looking for. Mastitis. Let's talk about mastitis. And of course, Coumadin for DVTs. That's in your book. On page 417, let's talk about mastitis. So this is an infection in the milk ducts. It's seen in about 10% of lactating women. I had it, had to go on antibiotics. Very painful. It looked like I was pumping an orange milkshake with the blood and the infection, like an orange Julius. So very painful, but it did go away. You just have to kind of pump and dump while you're getting your antibiotics. So, but you have to continue pumping or expressing the milk, okay? But it's just a clotted milk duct. It can happen for various reasons. I mean, I showered 2 and 3 times a day, stayed clean, and I still got it. So it's not because of not bathing or anything. It just happens sometimes. So just make sure you understand what mastitis is and the signs and symptoms here. Fever, chills. It can affect your lymph nodes as well. Nursing assessments for periputal infections. So just read through here. Watching the temperature, of course, in the first 10 days. So this is a big thing for discharge teaching. You're going to make sure that she is staying alert to her own health as well as her baby's. She needs to be reporting, calling her doctor if she feels like she has a fever. Okay. Postpartum infections. So we have the mastitis that we talked about. It's just a plugged milk duct. And infrequent breastfeeding, but I still got it, and I was breastfeeding every 3 hours. So endometriitis, this can happen just in the endometrial tissue, and then of course a wound infection, urinary infection, and pelvic thrombosis. So just make sure you read through that on page 419. These are pictures of mastitis, and this is what it looks like. Just some subclinical mastitis and then clinical mastitis. Alright, so let's look on page 420, and we're going to talk about postpartum depression. Okay. Psychosocial complications, so the postpartum blues. They can occur within the first 2 weeks of childbirth, or even sooner. I experienced this with my 3rd child the week after. It didn't help that he was in the NICU, but just crying for no reason, didn't know why I was crying, and it was just my hormones trying to get back level and in order, stable again. So it's very real. It can be a really bad thing. You hear the horror stories on the news about women driving in lakes with their newborn or whatever, but this is why as nurses we need to be assessing our patients, not just physically but their mental capacity as well. Okay. This happens, postpartum depression, in 10 to 20% of postpartum women. It is a very common, pretty common occurrence. Okay. There's signs and symptoms here on page 421 in this box. Make sure you read through those. And then assessing. Okay, so this is a wink and lollipop. You need to know what to do to assess for postpartum depression. And we use this tool called the Edinburgh Postnatal Depression Scale. Okay, and it is just asking questions. But this is what it looks like. I know it's hard to see that, but I'll show it to you in class. And just make sure you follow that. Okay. There's postpartum depression. There's treatments for that, of course, SSRIs, SNRIs, heterocyclics, other antidepressants, antipsychotics, and mood stabilizers. And of course there's some natural and herbal remedies, but you just need to tell your patients they need to talk with their doctor before taking any of those or any of these if they're breastfeeding. Okay. And it kind of tells you they've been detected in human milk or they hadn't, or very limited data, whatever. So alright, that is it for Chapter 12.